Welcome to Between Two Pastries, everybody. This is Nicole.
Hey everyone, it's Annie.
Today we have a lovely, lovely guest. Annie and I have been wanting to have a super smart oncology dietitian come on. And so we could talk about a bunch of things that I feel like we need to clear up around the concept of cancer prevention, as well as when individuals are going through it or trying to keep it in remission. And so just super, super grateful that our guest today said yes. And looking forward to opening up this conversation. So welcome, Sina. This is, sorry, in here I did it.
It's fine.
Sina, this is Sina Teskey, and I'm going to have her introduce herself because she just has a really nice, interesting background. So go for it, Sina.
All right, thanks for having me. My name is Sina. I've worked in oncology for almost my full career as a dietitian, which is about 15 years. I started in Minnesota, where I worked at a level 1 trauma center with a cancer center attached to it, and worked there for 5 years. Switched and worked in eating disorders for 2 years, and then we moved back to the Milwaukee area, and I've been working at Freidert's Cancer Center ever since, because oncology I've learned is my passion. I find there's a lot of research done in the area in terms of food and nutrition, and there's a lot of false information that's out there that I just feel very passionate about clearing up. And I was telling Nicole and Annie before we started, I've worked in oncology for so long, and 2.5 years ago, our 3-year-old son at the time was diagnosed with stage 3 lymphoma. So I've also now lived through having a person in my family go through treatment and struggle with nutrition, and it's helpful for me to talk to patients about that as well, because nutrition in cancer, which we'll talk about today, is really two phases. Are we healthy trying to prevent it, or do we have it and we're trying to be the healthiest we can be through treatment?
Absolutely. Absolutely. Awesome.
That's an incredible journey. And I just want to, say, whether you're looking at eating disorders or oncology, like they're certainly very, very different, but they're also very similar in the sense of the amount of fear people face. Just what, they receive a diagnosis, or they, something happens, maybe it's trauma or whatever, that causes a funny eating pattern, or causes us to go down that rabbit hole of researching all the wrong things. And I've had friends whose, parents contact, can you help my mom or my dad, because they were just diagnosed with cancer, and it's blood cancer, skin cancer, whatever. And then all of a sudden it's like they're starting to do all of these very peculiar eating rituals, and like eliminating things and adding things. And I need to drink bone broth every day now. And I'm like, where do you even hear this?
Right.
I wonder that myself.
Right? Like, who is making all of this up? And they're like legit, it's not irrational. It's like they found someone who, perhaps, again, same with, all dietitians, right? Like there's people who pretend to be nutrition experts, and there's people who pretend to be eating disorder experts, and there's people who pretend to be cancer experts, and it's totally false information.
Yeah, and I think we are at a point in society that everybody has somebody they know who's had cancer. We are all affected by this.
Right.
What I find is it's really interesting. There's tons of fear and stress that goes into food, and eating shouldn't be stressful.
Right.
On top of that, the amount of people want to help, and the way they think they can help is by telling people what to eat. We'll see patients that are doing great, and then they'll come in and say, well, my friend told me that I just have to be doing XYZ every day.
Right.
And I think what people forget, in most people going through treatment, the biggest nutrition risk is malnutrition.
Correct.
Yes.
Not getting nutrition.
Huge.
So to starve yourself,
right,
it's the biggest factor that would affect not going through your treatment as well.
Right.
Absolutely.
I can't tell you how many people have told, like, if you're, because this whole idea of, overweight and obesity, and that's a whole nother can of worms as it relates to BMI, right? But overweight and obesity, and I've always told people who, have that early diagnosis, it's good you're overweight. You've got a lot coming pretty quick, and you're, you know what I mean? Like this whole idea of, I need to be thin, because if I'm thin, I'm eating healthy, therefore I won't get cancer. pattern that,
Mhm.
and then they
Right.
get cancer because we know that it
Yeah.
there's a million different reasons why we
Mhm.
would get a diagnosis. We can't really pinpoint it to food, but a lot of people think it's food.
Right.
And they're thin, and now chemo is
No.
much
Yeah.
worse, and they're malnourished.
Mhm.
And it's
Yeah.
And
like
uncomfortable. Yeah.
your outcomes are much better if you're overweight
Yeah.
from a
And you
comfort
you don't have
standpoint at the very
fatigue
least.
and
Right.
and you know, if you have nausea for a few days, you throw up, you're not like dehydrated going in to get fluids.
Right.
I- it's true.
Yeah.
Mhm.
And
I mean,
I mean,
there are things.
it's weird to say, but that's
Yeah.
It's a true statement, and
Yeah.
there are things we can do to eat healthy and prevent cancer that are the
Mhm.
same as they are to prevent heart disease and diabetes, but it's not this strict diet, and it's about moderation. It's just
yeah.
choosing
Right.
more whole foods.
Yeah.
It's not.
Well, and it's
Exactly.
not even down to a science. I mean, you could eat all the right heart healthy, diabetic,
Mhm.
you could do all the right things to prevent cancer, diabetes, heart disease, pancreas things, all of the different things. Sometimes it's just gonna happen,
Yeah,
like
and still be diagnosed. Yeah, of
you can still
course.
be diagnosed.
Yeah. So let's clear up right away. Let's get into like the most common myths or the things that just really tick you off. So let's just start off with
Let's
that part.
irritate everyone right
Then,
away.
Okay.
yes,
Number one myth, and
yes.
I'm sure you've heard it, is that sugar feeds cancer.
Can't
The
stand
number
Oh,
one thing I hear.
the
can't
number one
stand it.
thing of why we wanted you to come on this
Yes.
show. So let's
It's
highlight
the number
this,
one thing I
please.
hear too.
Yes. So let's be scientists for a moment.
Mhm.
Sugar is a carbohydrate or considered glucose, which is an energy source. So when we think of sugar, we're talking about energy.
Mhm.
I explain to people a lot, energy goes to all of our cells. Our body is not smart enough to say, oh my gosh, sugar, and just the cancer cells absorb it. Any cell needs energy. Now, that being said, I remind patients because I have patients that will not go to Culver's and get a milkshake that has tons of calcium and protein because it has sugar in it. I remind people all the time excess sugar by itself doesn't have a lot of nutritional value. A bag of Skittles, I'll give that as my example. It doesn't mean that you can't eat them, and it doesn't mean that if you eat them, you should feel bad because it still is an energy source. Um, I remind people too, like if you're not getting a lot of nutrition and you currently have cancer, let's not even talk about prevention. Your body is hyper metabolic. You are using so much nutrition every day just to maintain your weight. I compare these patients to marathon runners all the time. You are in the middle of running a marathon. What does a marathon runner do when they're running for quick energy? They eat Skittles because it's
Yep.
glucose, it's energy. So
Most
that
people
is an
eat
energy
nothing.
source
It's
for all your cells. It
right.
is not, and I think the myth came about because people drink like a glucose solution before a PET scan, and then it lights up on the scan where your cancer is. Well, that's because cancer is really, really metabolic. So if you didn't put glucose, is just a quick way to show that you could put protein in, and it's still going to be more metabolic in the
Yeah.
cancer than it is in the other areas.
Right. Right. It's one of the most frustrating things I think we hear.
Mhm.
Yeah.
It
So I'm sorry, Annie. Go ahead.
Well, I was just gonna say, if it's not, at some point it's where people get sugar is bad. I
Right.
shouldn't have sugar. I shouldn't. So then you start to create, as a dietitian, obviously we start to combat that. This is not true. You start to, and
Mhm.
then it eventually gets to that. I don't want to have cancer.
Hmm.
Sugar causes cancer. I mean, think back to the 80s and the 90s
Yeah.
when diet soda causes
Mhm.
cancer.
Yeah.
Right.
I still hear that from people.
Hmm.
Oh my gosh.
And those studies were done with like 2 cases of Diet Coke on one little mouse.
I
I'm like,
know.
Oh,
who drinks
wow.
that much diet soda?
Right.
Don't multiply
Wow.
that by your weight.
Correct. Yeah, and I
Mm-mm.
think the most current research was showing like was it like you have to have like it was like hundreds per day. I mean, it was something
It's hundreds
ridiculous.
per day, and they've never been
Yeah.
able to redo that study and show the same results.
Oh
Correct.
gosh.
So
Correct.
I see how information gets carried away, but I think the hard piece is food is something we can control. And I know this from when my son was sick. When your loved one has cancer or you have cancer, there's not much you can control.
Mhm.
But then this turns into this fear. In,
Yeah.
in my case, my son was 3, turning 4. And I also disclose this to my patients all the time. He just had no appetite. And 4-year-olds are supposed to grow every month. He
Mhm.
didn't gain a pound through 6 months of treatment, but he didn't lose, right? So we'll call it a win. The only thing he wanted for breakfast every single day was a donut. We had a donut for breakfast for 2 months, every
Yeah.
single day.
Yeah.
And that's fine.
That's
Yeah.
okay.
Yeah. And now, do we have a donut for breakfast every day now? No, because we're not in that phase. Do we have donuts on the weekends? Yeah, but
Mm.
not every day.
Right. Right.
Right.
Right.
There's a balance.
Right.
Balance.
Right. It's the same concept for everything, basically. So besides that one study, pronouncing about, the Coke or whatever causing cancer, where else do you think people are finding out this information? And when you try to tell them it's really not that way, do they still argue with you?
Luckily, the diet soda one doesn't come up a lot anymore.
Hmm.
Um, People actually are really, I find people almost like relax in their seat when we talk to them because people
Good.
hear it from friends. I think it's like passed on. And I think the internet, right? You can find any answer, a yes and a no. Um, but a lot of people, when we talk about sugar, feel so much better because they're like,
Good.
that's good to know because when I leave chemo, like I'm starving, it's
Hmm.
6 o'clock at night and I just want to stop and get a milkshake. I'm like, great,
Mm.
get a milkshake. And I always say, and throw some protein powder in it. And then you,
Yeah.
you kind of got a good meal there.
Yeah. Well, and that's the thing too, and especially when people are undergoing chemo, it's what are they going to tolerate? You
Yeah,
know,
you have nausea
what
or
yeah, what's going to feel right? Yes.
you get full quickly. I mean, some people have diarrhea, some people have constipation. So
Right.
that is the number. I mean, there's lots of myths, but that is
Right.
the number one myth about
Yes.
cancer.
Absolutely. All right. So, second myth.
Okay. Second myth would probably be that you have to go vegan.
Oh,
Oh
right.
my
It,
You
gosh.
have to go vegan for everything. You just everything.
Oh, you're
Uh,
making me like,
Such a joke. Gosh.
I didn't mean to upset you, Annie. I just, this is where the patients take me. Um, so again, I think this is a fear piece and something of control.
Mm.
Plant-based has gotten a lot of, um, you know,
Yeah.
it's just big right now. But what people forget, and for years, like the American Institute of Cancer Research has said, have a higher plant-based diet, meaning 2/3 of your diet is fruits, vegetables, and whole grains.
Sure.
1/3 still is meat and dairy.
Right.
just
Um,
let's just focus on the fact that you said whole grains in there too, because people who are
Yes.
plant-based still want to eliminate carbs.
Correct.
Like there's
Well,
still this elimination. They think
When
it's
it's
just
a
nuts, seeds, fruits, and
yeah.
veggies.
Yeah, and grains are a plant.
Grains are a plant.
Right, right. And even just what you were saying for like cancer prevention, like to me, that's just isn't that just normal eating? I mean,
Yeah.
isn't that just normal eating? Please
Right. The
hear this.
concept of
Please hear this,
80%, 80% of the time you're eating fruits, veggie, lean
Yeah.
meat, whole grains, some
Yep.
dairy.
Yep.
I don't know. It just seems like
It's so
right there.
what I've liked that they've done some more in with cancer preventative recommendations is they're starting to give some more numbers, which I think is helpful because
Yeah.
patients are like, okay, you tell me to eat less, but what does that mean? So there is research that diets extremely high in red meat or processed meat
Sure.
have a higher risk of certain GI cancers like colorectal cancer because
Yes.
it kind of causes some inflammation in your gut.
Yep.
Inflammation can cause cancer growth.
Sure.
So what does that mean? They now define it as limit red meat, which would be pork, lamb, or beef, to 12 to 18 ounces a week.
That's a lot.
That
That's a
is
lot of meat.
again, isn't that just normal? I mean,
Yes, I know.
A
that
And this
lot.
doesn't
is
even
what
feel
I
like a limit to me. Like that doesn't even feel
So
limited.
people
Like, is
eat
that
more than
limited?
that?
I mean, I guess if you had bacon for breakfast, a ham sandwich, and then a steak every night, but I mean, that's not
Oh
a lot of
yeah.
people.
I
Yeah.
can't imagine that is. I
Yeah.
mean,
That's
I
wild.
certainly don't see ones who are eating that way
Yeah.
in my line of work,
But like
but
you just said, though, those numbers are really reassuring.
those are
Yeah.
generous.
Again, I mean,
I thought you
just
were,
yeah. I mean,
gonna say
but
like
that
4 ounce.
here are the studies and here's the real number behind it. Not only is that significant, but where does everybody need to be vegan come from? Do you
Right.
hear what I'm saying?
Right.
So that's kind of so bizarre. Anyway,
Yeah.
okay.
So to put that for people that don't think about meat in ounces, a quarter-pound burger, that's 4 burgers in a week.
Yeah, I mean,
So I think To me, it's people that want to try to have a healthy diet to prevent cancer. I tell people it's just making small tweaks.
Mm.
Maybe one night a week, try to cook vegetarian because it just gets you more whole grains and more
Yeah.
fiber. Try some beans, try some lentils. Beans are so high in antioxidants.
Mhm.
It's not about avoiding the meat, it's also about adding the beans.
Yeah.
Um, and to get to my next myth, which will be soy, but add some tofu in because soy has a
Right.
ton of antioxidants. So it's small tweaks in your diet to help prevent or
Mm.
just really to be healthy.
Right. Love it. Let's talk
Mhm.
about soy because I love soy.
Oh,
I do too. I love soy. We drink soy milk in our house.
Yeah.
Um, so people are very worried about soy and the
Mhm.
estrogens in soy, and especially patients that already have estrogen receptive positive breast cancer.
Right.
mhm.
And I get it, right? You hear it's the same word in
Sure.
both of the products.
But it's a very different thing.
Yeah.
Very.
So soy has a natural phytonutrient in it, which just means a nutrient in the food that can help prevent disease. It's called an isoflavonoid, and it helps prevent cancer.
Mhm.
So, countries like Asia, or cultures that have a very high soy intake, edamame, tofu, miso, they actually have a really, if you look, low risk of breast cancer.
Yeah.
I think the piece to note about soy is there's a lot of processed soy out there, and in
Yes.
general, right, a healthy
Yes.
diet is more whole foods, less processed food. So if we
Right.
can eat less of the meat alternative soy
Mhm.
items, great, but like tofu, soy milk, great.
Awesome. Yeah. And talk about the huge amount of calcium in those as well,
Yeah.
which is so awesome. So
And then there was some research that actually showed certain stages of life, if you have soy during them,
mhm.
you decrease your risk of breast cancer. So one of them, you may not know if you're having a boy or a girl, but if you're pregnant and you know you're having a girl and you were to drink soy milk or eat more soy products. And the other is girls going through adolescence. So anytime
Mhm.
when your
Mhm.
body is, you know, multiplying cells rapidly, with growth and development, and you have soy, it's preventative.
So nice. That is so great to hear. I love that nugget of information.
Yeah.
Yeah. So, okay. So, just for time purposes, we talked
Yeah.
about the three things that we hear often, the myths. So, what are, say, three factual things that you haven't said yet that you would want to share with people?
Okay. Moving your body is important. So, 150 minutes of moderate exercise a week, that's a walk, is really proven to decrease risk of cancer.
Mhm.
And from what you know, why would that specifically do that?
Well, when we move our body, for one, we're using up some of our energy. We're keeping things moving healthy. We're keeping our heart healthy. We're
Mhm.
decreasing inflammation. And
Mhm.
all those stack up to have less cell damage.
Mhm.
Well, I wanna bring up so you say, walking every day, and what a lot of people will start to hear is, "I need to exercise, and if walking is good, then this over here is excellent. So I'm just gonna do this over here." And then we know walking can help reduce inflammation, help the heart,
Mhm.
but if I do this over here, now I'm creating more inflammation.
Right.
So
So there's a
it's
balance.
again,
Right.
there's no balance, and again,
Mm.
people go from,
One
it
extreme. Yeah.
one extreme to the other
Mhm.
Well,
Yeah.
and
and
miss that middle ground.
Yeah.
yeah. So if you're doing vigorous activity, they say 75 minutes
Right. Exactly.
Total.
Half.
total in a week, not
Exactly.
in a day.
Wait.
Exactly. Oh, such a good point.
Yeah.
Yes.
Um, all right. So we talked about red meat, we talked about soy, we talked about sugar. The other thing I'll say is alcohol. It is
Mhm.
proven the less, if we don't drink alcohol, it's the best. If we
Yeah.
do drink alcohol, to limit it.
Mhm.
For women to one drink a day, for men to
Mhm.
2 drinks a day.
Yeah.
Which I still feel is really generous.
Yeah, I do.
Yeah, that's every day. And that
Right.
also,
That's every day.
let's talk about moderation. That doesn't mean you get to
It's
like
not
save
cumulative. Yes.
all
Cumulative.
7 of your
Yes.
glasses of wine
I
for
know.
Friday night.
I get that a
Right.
lot. Yeah.
Yeah.
Mhm.
Yeah.
Well, but
Um,
again, that's the extreme thinking, right?
Yeah. No,
it's
totally.
it's extreme. Yeah.
Yeah.
And then I'd say the last and probably most important is just cook more at home and eat
Mhm.
whole foods, like eat
Yeah.
real food.
Yeah.
Mhm.
Yeah.
Cruciferous vegetables in particular, like Brussels sprouts, cauliflower, broccoli. I mean, those are great things to eat regularly.
For sure.
You can
For
make them
sure.
so many different ways too. You can
Mhm.
Right.
roast, boil, grill, do whatever, like there's
Yeah.
tons of different seasonings, and you can find seasonings that have salt, don't have salt. You can make your
Right.
own. You can get really
Mhm.
creative with that stuff. And I think part of sometimes where we see some roadblocks is people who, well, I'm not going to cook.
Yeah.
I'm not going to eat that.
Mhm.
I'm not going to do that. And
Mhm.
at some point you just kind of shrug your shoulders and go, okay,
All right. I
Yep.
mean,
It's true. I mean,
then good
because
luck.
there are some people that don't cook, but you could still keep fruit around and like baby
Yes.
carrots.
yeah.
Yeah.
Don't cook,
Right.
order out, but eat some fruits and vegetables during the day.
Right.
Exactly.
Right. Right.
Exactly.
Kind of
Exactly.
finding that meeting them where they're at a little bit, but also
Mhm.
sometimes there's that serious resistance. And it's, there are people in the world that don't care if they have heart disease or diabetes or cancer, and they just don't, they're not going to change their diet, period. But then
Mhm.
again, the other spectrum, which we see so much more often, is this kind of going crazy about food and all exercise and stuff like that.
Mhm.
Yeah.
So, one of the other questions that I would have to you is, do you find that there are more specific recommendations for, say, specific cancers? Like very
Mhm.
specific things that you would recommend for GI versus a lung cancer versus a pancreatic cancer?
A little bit. And I don't know if it's just this, I don't know if it's based on how much research is done. Breast has a lot of research that has been done with it. Breast has a lot of the research on movement. There's been
Mhm.
a little bit of research on Mediterranean diets with breast
Mhm.
cancer and the prevention of that. And some research on a low fat diet, basically low fat being like less trans fat, again, less
Yeah.
processed foods.
Right. Right.
So that's specific. And then when it comes to like GI specific cancers, it's really the red meat. And that kind
Mhm.
of goes with multiple different cancers,
Yeah.
like specifically to like blood cancers, lung,
Mm.
lung is a little, pancreatic. There's not, it's just, be healthy, make good choices, make one small change. Maybe you go out to eat and you usually get fries with your burger. And this time you were like, you know what? I'm going to get a salad.
Right.
Cool.
Yeah.
Next time, get the fries, but just try something different.
Mhm.
Uh, I would say there's not tons of specific. Once people have cancer, there's different considerations.
Mhm.
With some like pancreatic cancer, you're just at a little bit more of a risk of some diarrhea and some other issues, but prevention wise, no.
Right. Mhm.
Do
Mhm.
you get a lot of questions or concerns around what the general public would consider processed foods as
Mm.
the cause of cancer?
Luckily, most of the patients, once they get to us, don't talk to us about how the cause. Every once in a while, somebody will be fearful of that.
Mhm.
But for sure, I think people want to blame something.
Mhm.
Oh, yeah.
Um, I've
Oh,
had
yeah.
people ask me that, and I'm like, you could. I mean, why did my 3-year-old get cancer? What has he
Sure.
done in it? He's only
Right.
been on this earth for 3 years. Like,
Right.
Absolutely.
when we were in the unit, there were babies there. So,
Mm.
I just think it's not something that we will ever have a pinpoint answer to. We can know risk factors. We can know smoking increases risk of lung cancer. We can know drinking increases the risk of cancer. But we can't blame ourselves for the decisions that we made. We need to that stress isn't helpful
Stress
either.
is the problem.
No.
Yeah. Right.
Yeah.
Right.
Huge.
Yeah. I
Mhm.
mean, I'm just, because I kind oftentimes we'll hear, well, processed food, and you hear it in the media as well. Processed
Uh-huh.
food causes cancer. Similar to sugar causes cancer,
Yep.
but even
Yep.
like, well, don't eat boxed foods or don't shop in those middle aisles because, cancer can, and it's, obesity, cancer, diabetes, heart disease,
Mm.
like we all kind of lump all that together.
Mhm.
Right.
So
Yeah.
if you eat processed, you're poor, you're fat, you know what I mean? Like
Yeah.
those,
Yeah.
all the things that, and you eat sugar, processed foods, your status is a little lower, then you're going to have all these problems.
And it's funny is you could also live to 100 doing that.
I
So
Exactly.
there's
know.
just so
Exactly.
much more going
Yes.
on.
Right.
Absolutely.
Right.
Absolutely. Sina, I'm also kind of curious too if you have like, is there like one piece of advice or encouragement that you find yourself giving your patients more often?
Patients, not on the prevention side. Again, this would be patients that are going through treatment.
Sure.
It's making sure you get enough protein.
Nice.
Your protein needs are really high. I mean, getting enough calories. It's probably
In
both. Getting
general,
more
yeah.
protein. We talk a lot about actually protein additives because you can't. Most of the time people don't really want to eat
I
meat during
know.
chemo. It's one of the
Yeah.
first foods that tastes kind of off.
Mhm.
So we're using a lot of protein powders. Another thing is we talked a lot about switching back to high fat foods, like drink your
Yeah.
whole milk, add butter to everything.
Yes.
We used to put we used to give my son a bagel and I'd load it in butter and then cover it in cream cheese. Because if you're only
Yes.
going to eat this tiny little portion, I need to
Right.
load everything in cream.
Everything.
So
Yeah.
I'll have patients say to me, like, I never thought I'd get to eat like this again and be told it by a dietitian. I hear that all the time. This is a first.
Yeah. That's
Yeah.
fantastic. Oh.
Well, and I think that's hard though in our field because you've got, you put a pool of a dozen dietitians in a room and you'll have someone who says 1,200 calories, that's what
Sure.
you should eat. And you have someone who says whole milk is okay, or whole milk is bad, or you know what I mean? Exercise this way or that way. And it's really confusing to people.
Yeah.
And so I've kind of just started when people ask saying, I work with eating disorders.
Yeah.
And
I
just
work
be
in
done with
oncology
it.
and just
Yeah.
be
Yeah.
done. Like, because they hear you're a dietitian and it's like, if you just say, oh, I'm a dietitian, it's, oh, I shouldn't be eating this in front of you.
Right.
Yeah.
Or what do you think about eating this? And it's just,
Yeah.
and then you're like, I work with eating disorder. And then they shut up.
Yeah.
Like, it's like
That's true.
clicks. But it is really, really hard for people, I think, because there's so much information like we've talked about, but
Mhm.
also you could literally in your 20s work with a dietitian who says something, in your 30s who says he's something different, in your 40s hitting, let's say, menopause,
Yeah.
then you have cancer, and all 5 dietitians tell you to do something different.
Right.
Yeah.
It's confusing, and that's, I
Yeah.
think,
Well,
really
there's
hard
a
for
lot of beliefs on nutrition.
Yes.
You have to find, finding a dietitian is like finding a therapist. You got to find somebody
Mhm.
that gets you and
shop
gets your
around.
goals.
Yeah.
Shop around.
Yeah,
Yeah.
Right.
absolutely.
Right.
Absolutely.
Totally. Totally. Any final words that you would have for everybody, Sina?
Just don't stress out about food.
Right. Thank
Mhm.
you.
I feel like that stress will cause more issue in your body.
Yeah.
Yeah.
And anything else you could physically put in, that's a
Yeah.
food.
So
Yeah,
good.
absolutely.
Mhm.
And we always like to ask our the people that we interview when they come on what their favorite food is. What would you say your favorite food is?
I would
Donuts.
probably it's definitely my son's favorite food. Um, I would probably say pizza or ice cream.
Oh, cool.
She's in my camp.
That's funny.
What's yours?
She's not in the kale camp.
Yeah.
Oh, I mean, don't get me started. I love kale and broccoli. Our kids, if I make kale chips for dinner, they're like, yes.
Oh, that's so
How many
cool.
are you gonna make more? I love them. And I'm like, oh, so my daughter would say artichokes. I love vegetables, but
Oh,
if I think of
yeah.
what I could eat every day,
Yeah.
or salad, I love salad with pizza.
Yes. Yeah.
Oh, yeah,
Nice.
yeah.
That's really awesome.
Dressed salad.
Yeah.
Dressed, oh, for sure. Full fat dressing on salad. Yeah.
That's so awesome. It's great.
And homemade croutons. Those are the best.
Yo,
Oh,
yes,
those are
I
good.
love
Mhm.
croutons. Oh my gosh. Yeah,
Oh,
definitely.
goodness.
Awesome. Well, thanks so much for joining us today. We really appreciate you being here. And we are going to put all of Sina's information in our show notes. And Sina, if you have any resources or anything, any references that you think would be interesting for our listeners too, please feel free to pass those along and we'll include those as well. So
Absolutely. Thank you.
awesome.
It was a fun. I
This is
appreciate it.
great. Yeah,
Yeah, this
thank
was
you
great
so
info.
much.
Thank you.